What is Alzheimer's disease? Alzheimer's is a type of dementia that affects memory, thinking and behavior. Alzheimer's is the most common cause of dementia, a general term for memory loss and other cognitive abilities serious enough to interfere with daily life. People with younger onset Alzheimer's can be in the early, middle or late stage of the disease. Alzheimer's is a progressive disease, where dementia symptoms gradually worsen over a number of years. In its early stages, memory loss is mild, but with late-stage Alzheimer's, individuals lose the ability to carry on a conversation and respond to their environment. Alzheimer's as a continuum. Alzheimer's disease progresses in stages, with the severity of symptoms increasing over time. Asymptomatic and asymptomatic individual may have biological changes of Alzheimer's in their brain but no cognitive symptoms. Hallmarks of Alzheimer's, such as amyloid buildup, may be present up to 20 years before someone exhibits changes in memory, thinking or behavior. Mild cognitive impairment, MCI due to Alzheimer's disease. MCI is an early stage of memory loss or other loss of cognitive ability in an individual who maintains the ability to independently perform most activities of daily living. MCI can be an early stage of Alzheimer's if hallmark brain changes are present. Learn more about MCI. If those changes are present, the person may progress into dementia due to Alzheimer's disease, which can be divided into 3 stages: mild, moderate and severe, representing a progressive loss of independence. Learn more about the stages. Mild dementia. A person living with mild dementia due to Alzheimer's disease will typically start to experience symptoms that interfere with some daily activities. Moderate dementia. Symptoms are more pronounced for someone living with moderate dementia due to Alzheimer's disease and will interfere with many of their daily activities. Severe dementia. An individual living with severe dementia due to Alzheimer's disease will experience symptoms that interfere with most everyday activities. Alzheimer's has no cure, but one treatment, aducanumab, Aduhelm, is the first therapy to demonstrate that removing amyloid, one of the hallmarks of Alzheimer's disease, from the brain is reasonably likely to reduce cognitive and functional decline in people living with early Alzheimer's. Other treatments can temporarily slow the worsening of dementia symptoms and improve quality of life for those with Alzheimer's and their caregivers. Today, there is a worldwide effort underway to find better ways to treat the disease, delay its onset and prevent it from developing. The most common early symptom of Alzheimer's is difficulty remembering newly learned information. Just like the rest of our bodies, our brains change as we age. However, serious memory loss, confusion and other major changes in the way our minds work may be a sign that brain cells are failing. Alzheimer's changes typically begin in the part of the brain that affects learning. As Alzheimer's advances through the brain, it leads to increasingly severe symptoms, including disorientation, mood and behavior changes, deepening confusion about events, time and place, unfounded suspicions about family, friends and professional caregivers, more serious memory loss and behavior changes, and difficulty speaking, swallowing and walking. People with memory loss or other possible signs of Alzheimer's may find it hard to recognize they have a problem. Anyone experiencing dementia-like symptoms should see a doctor as soon as possible. If you need assistance finding a doctor with experience evaluating memory problems, your local Alzheimer's association can help. 2 helpful support resources you can tap into are Alz Connected, our message boards and online social networking community, and Alzheimer's Navigator, a web tool that creates customized action plans, based on answers you provide through short, online surveys. Take our free, online education courses, Understanding Alzheimer's and Dementia and Know the 10 Signs, Early Detection Matters. The Alzheimer's Association is the trusted resource for reliable information, education, referral and support to millions of people affected by the disease. If you or someone you know is experiencing symptoms of dementia, it is best to visit a doctor so the cause can be determined. Microscopic changes in the brain begin long before the first signs of memory loss. To do their work, brain cells operate like tiny factories. Scientists believe Alzheimer's disease prevents parts of a cell's factory from running well. As damage spreads, cells lose their ability to do their jobs and, eventually die, causing irreversible changes in the brain. Though autopsy studies show that most people develop some plaques and tangles as they age, those with Alzheimer's tend to develop far more and in a predictable pattern, beginning in the areas important for memory before spreading to other regions. Scientists do not know exactly what role plaques and tangles play in Alzheimer's disease. It's the destruction and death of nerve cells that causes memory failure, personality changes, problems carrying out daily activities and other symptoms of Alzheimer's disease. Researchers are working to uncover as many aspects of Alzheimer's disease and other dementias as possible.